But
Yeah.
uh,
This is my son and daughter-in-law.
how you feeling, dear?
Feel fine.
You're fine, good. Do you mind if I take a look at your feet?
Oh, yeah.
They do. That they're pretty worn now. They really are. They're still got the hook.
So basically, let me close the door. So basically, the story that you mentioned that you were in a golf course and was a little cold.
Yes.
So probably what happens was around the line of frostbite.
Okay.
So the toes on both feet are dead. This is basically gangrene, but it's like a dry gangrene, meaning that, sometimes when it gets cold, sometimes, I don't know exactly in your case what happened,
Yes.
the blood vessels clamp down because it's cold, and the blood doesn't get to the toes and toes die. So that's what happened on both sides.
Okay.
So they part of the foot is good. You can kind of see it's good to hear.
Yes.
It's good on the right side. There is more good part. On the left side, the part that's involved extends a little bit further down.
Mm-hmm.
So basically, we know where it's good, and then we know where it's bad, and then there's that border in the middle that it's kind of iffy. Sometimes gets better, sometimes gets worse. So typically on these, we like to give it some time until the part that is iffy tell us is it got better or not got better.
Okay.
On the right side, you most likely end up with removing the front of the foot
Okay.
because all these toes are involved.
Mm-hmm.
And there is a good amount of tissue on the bottom, good amount of tissue on top that we can close. On the left side, the tissue that is not good extends a little bit further down.
Yes, sir.
We could still try to do half a foot removal, but what happens is that you need to have enough tissue to close it, and so you have to make the bone really short to close it. And that side, most likely, that's possibility too.
Okay.
So we can consider doing the surgery when we are convinced that it's not getting better anymore.
Okay.
And that's hard to tell. So you have what's called dry gangrene, meaning the toes that are dead that are kind of harmless. Wet gangrene means when it's infected and the pus is coming out and it's moving. So right now, when the time that the foot got cold, the tissue that was gonna die died at that time.
Oh.
So giving it more time, the toes aren't gonna get better. But that border may get a little bit more clear, or some of it may get better. So when we're gonna do surgery is when you guys and us are convinced that it's gonna get as good as it's gonna get.
Okay.
So that's why I want to give it some more time until you're convinced that the foot is not getting better. Because sometimes, initially when the frostbite happens, the toes will start getting like bluish, and a lot of times, sometimes it gets better. But in your case, the toes are what we call mummified. I mean, if you touch them, they're not going to get better.
Right.
The question is that, is this border going to get a little bit better or not? Are we going to be able to get a little bit, do we have to go here or can we? Because for, at least on the left side, the amputation is going to be here because we need the tissue to close it, you know what I mean?
Yes, sir. Yes, sir.
So if you do it here, well, how are we going to close it? So we have to, so anyway. So the left side is a little bit more tricky. Also, you got to realize you're not 18 anymore. Sometimes you when you if you do it here and this doesn't heal, then you have to go here.
Okay.
So
Do you want me to mark it off, Dr. McGrady?
which one?
Mark her feet off.
Oh, and I think it's already marked off.
Okay.
Oh yeah, the board everything good and bad. So I'm here this weekend. If you guys, I'm gonna put you tentatively on surgery for Sunday.
Oh.
Okay. Oh, wow. Okay,
Well,
good.
well, yes. I mean, I can do it tomorrow, Saturday, Sunday, anytime. But I want to make sure that you guys are all on board with it. The right side most likely is gonna heal if we do just a half a foot amputation, because you know what you gotta realize is that the tissue here is dead, but this area is also doesn't have a greatest blood flow because so if you're gonna do it, it's gonna be here. Here is gonna be a little bit more further away. This is iffy. If this doesn't heal, then we have to go higher.
Okay.
So we're gonna wait a little while and see if that,
Well, I don't think at this time waiting too much longer might not necessarily change anything.
yeah.
That's what I'm
But
gonna-
so that's what I want to hear from you guys. Do you guys wanted to? Are you guys wanted to kind of have the surgery sooner than later, or are you guys convinced that it's not getting better?
And I guess what we are is depending on your
It's not gonna get better.
boom.
So,
You just answered
but
it. That's no.
but the
you're-
thing is that sometimes patient and family are hoping that it getting better, and in this case, it's okay if you give it more time, because it's kind of dried up tissue. It's not an infected tissue. So if you or you guys say, you know what, to us it looks like it may be getting a little bit better. Can we give it more time? We can give it more time. If you guys saying that, you know, I think we are pretty convinced that it's not getting better, then I can put you on the schedule this weekend, most likely on Sunday, and kind of do the surgery.
and go from there.
So what about the autoimmune disease?
That's not my part. I'm not that smart. There are different doctors taking care of it.
So she did, okay.
Yeah. I'm not. Yeah. Those are different. Yeah.
Okay.
I'm one orthopedic. I'm just helping with the foot.
Yes,
Yes.
okay.
The medical doctors are checking the blood and do all
Yeah,
this stuff.
okay,
So
Hematologists.
yeah.
and all that.
Those
Okay,
are
gotcha.
different. So
So it is not. That's mummified. It is not getting better, and basically what
mummify is a layman terms. we
You're
use
right,
for
right.
it.
And I understand.
Yeah.
there's blood,
Yes.
It's
Yeah.
dry.
It is dry gangrene. It's not a gangrene that if you wait, it's just gonna creep out of your body.
Yes,
Right.
yes.
When the cold blood, most likely, when the cold weather hit, your soft tissue is so fragile that even though the weather may not be too cold for us, it was cold enough for you that those tiny vessels clamped, and they were clamped enough that those tissues suffocated and died. And initially were a little bluish, but then as time went on, the dead tissue showed itself more, and it just became more deader.
That's
you know.
why.
Yes.
Yes.
Yes, but the only thing is that you gotta understand that if you do the mid-foot amputation, if it doesn't heal, you have to go higher. And
Okay.
your age and your tissue quality and all that plays into how well you heal.
Being that, your recommendation.
At some point, sooner or later, you're gonna have the surgery.
Right.
And time will tell.
how far?
Well, no.
Oh.
We're gonna plan on where far, but if it
Okay.
doesn't heal,
Right.
then you get forced to go higher.
Okay.
Oh, okay.
Because in the foot, there's just this thin tissue that's over the bone. When you go higher, at this time, my recommendation is to remove the dead part. But if that is not, we suture it up and 3-4 weeks later, just nothing is healing, then it gets you forced you to go higher.
It forces you to go higher. But and that's not something you can tell during surgery. It's you have to close it up.
Yeah.
She has to go.
Your body gotta heal.
Okay.
And during that time, you cannot put any weight on it because,
Yes.
you know.
That's why she's not walking to the porta potty, why she has to use the bedpan.
Yes,
now.
even
Per your
after
order.
that, you cannot, because you put
Okay.
weight on it, that suture is gonna pop open.
Pop open.
The other thing that we do typically when we do that, we lengthen the tendon here, so once this is healed, you have a better mobility of the ankle. But that's like a two liter poke, that's not the.
Right.
So if you guys are convinced as I am that this is not getting better, then we'll plan for surgery. If you guys say, well, you know, is it possible that it gets a little bit better, and can we give it a little bit more time? Sure can. So.
Mom, I'm thoroughly convinced. What is your thoughts?
Well, the way he put it then, might as well, I think, go ahead and set it for Sunday.
Sunday, or as soon as he's
Yeah.
willing to do it.
Yeah.
That's, how soon do you need a final answer from the
No,
group?
so I'm in. Tomorrow the operating room is packed, and I can. The reason I said Sunday to give you guys some time to think about it. So
Okay.
you have time to think about it, and then if you, because you know you have tomorrow and you have Saturday, you think about it, and you're like, and you can see the fit again. You come on Saturday, take it off, it looks a lot better. Then we're like, oh, hold up, you know.
Right.
I don't think that was the case, but you know, yeah.
Yeah, so basically, is what I'm understanding is we can schedule.
What I'll do is that I'll reserve the stuff in the operating room. You gotta realize it's a weekend. So if I have you for 10 in the morning and somebody with a bad car accident comes in, then 10 in the morning may turn out to 10 at night. But I'm in the operating room tomorrow, Saturday, Sunday, and Monday.
Mhm.
So if I put you on Saturday and you guys say, oh, we need a little bit more time, I'll put you on Monday. Monday, you have more time, I'll put you on Wednesday. So I just want you guys think that until you guys are convinced, we can wait.
Yeah,
Because you're not sick, there's no pus draining, this is not moving up.
this is what it is.
This is what it is, yes.
And of course, my age doesn't help any of it, I guess.
Well, you know, you can brag about it. But
She does, don't get her started.
Yeah.
Well, then Mom, unless somebody else speaks up, and you especially, tentatively, let's go for Sunday. If something changes, we'll beg his forgiveness and say, no, we need to.
No,
back
actually,
up.
yeah, so even until we roll up to the operating room, you guys can change your mind. So that's not, I just want to make you guys know that you're not under pressure to have a surgery as soon as possible, but this is not gonna,
Change the outcome.
I've had patients that say, I want to wait longer, and we'll send them home. I don't think in your case, because, but if somebody was younger and it was just a couple of toes and they could move around,
Right.
and they went home and saw me in the clinic a month later, and they said, well, no, I'm ready. I realize it's not going to get better.
Right.
So,
Okay.
That sounds, yeah,
all right. So I'll put you on the schedule for Sunday, knowing that right now when I add you to the operating room, you may be the first one in the morning, but as more stuff
Right.
come in, you
Right.
may move. But and then on Sunday until before the surgery, if something changed, we can always wait.
Awesome.
Sounds good.
Perfect. Thank
Any
you.
questions?
how long is surgery and all that does it
Yeah, well, we do both of them at the same time, so it
Good.
usually takes about a couple of hours.
take? Okay,
You know, usually about half an hour, 40 minutes each time, and then we're gonna close it and so forth.
I have a question.
Yeah.
So they said that she has an autoimmune disease,
Yes.
and that's what caused this.
Well,
So you're saying something different.
no.
Okay.
No. I'm taking care of what the damages happen.
Uh-huh.
Well, the story when I came a couple of days ago and I talked to you, the story was that you were in a golf course and it was a little bit chilly and you had it covered up here, but the feet weren't as insulated.
Exactly.
So that usually goes along the line with frostbite. Your autoimmune disease may have put you in a more vulnerable situation.
Gotcha. Okay.
But this is, so yes, your autoimmune disease may just made you more vulnerable
Okay.
that little bit of a cold just caused more damage than typically would.
yeah.
And they still need to treat your autoimmune disease, but we're just left with take care of what the damage is,
Yes.
you know.
So what about, how did her CT scan look? Did you have?
Of what?
her.
We were,
Yeah, I'm not,
He doesn't have any idea
no, no,
about
no,
that.
You didn't read
no,
it?
no, no,
Okay,
no,
I
yeah,
thought
yeah.
you did.
Yeah,
That's
so,
all there
so when people come to the hospital, they're under the care of the medical team. And the medical team would consult different subspecialties. So if somebody, God forbid, broke their hip, they consult me to come and fix the hip. At the same time, they may have a heart disease, the lung may have an issue, they may have a stroke, so there may be a neurologist, orthopedics.
Okay.
So when I see you, my focus is here.
Yes.
The medical team kind of keep tab of a little bit of everything.
Good, good.
So if there's somebody has a belly issues, they consult general surgery. So there may be a lot of things out there, but I'm not the right person to get into those details with you.
This is-
Okay.
This is it.
Got it.
Yes.
But-
Yeah, but
Surgery.
if you have questions about other issues, those other doctors should explain
Yes.
that to you.
Yes.
You know, like, so-
Yes.
So I'm just not the right person
Got
for
it.
those.
I'm asking the wrong, got it.
No,
got it.
So about
Okay.
a couple hours for surgery then,
yes.
and then what after?
And then
that?
after that, you'll be in the hospital for a few days to get some antibiotics, and then you probably go to rehab. The challenging thing would be that you cannot put any weight on it, and unfortunately, somebody your age that could have a little bit more consequences. So they gotta get you on the chair a lot so you don't get ulcers and so forth.
That'll
and,
be
you
taken
know,
care of then.
Yeah, so that kind
Well,
of thing.
this is,
And the main thing is that your left foot, the damage is a little bit more than right foot.
right,
There's not as much good tissue to work with, and there's a risk that what we do may not heal, and then you have to go higher. But I don't think we should go higher.
okay,
There's a possibility that we may need to dress if needed.
okay.
Yeah.
That's
One
it.
of the doctors said, and what leads me to have confidence is,
Yeah.
is some of the doctors had said, you're kind of a one and done. You're gonna go, you're gonna try to get everything, cause you only wanna try to get in there one time.
Yes, but your body still needs to heal.
And
The
you have no
incision side.
control over.
No, and sometimes it heals and sometimes it doesn't. So,
Sometimes.
you know, and all the stuff, the autoimmune and tiny vessels and so forth and so on will play into that. So,
Okay.
yeah. All right? Okay.
Sounds
We'll
good.
see you next year.
That's right.
You guys have a